All right, guys, and your batch of notes that you would have received from Dr. Maraj, you can open up. There is let me see if I get the name. There is a PDF by the name of Lecture 1. You can open up that because we're going to do primary healthcare. I did a PowerPoint presentation to help condense this this one that I've asked you to open, and I will send that PowerPoint presentation today to Dr. Maraj to give to you guys. Okay? So we're going to talk about primary health care. Primary health care. Let's get a definition, a working definition of primary health care. It's defined as as essential health care based on practical, scientifically sound, and socially acceptable methods and technology, making it all universally accessible. Emphasize that point, accessible, making scientifically sound, socially acceptable methods and technology universally accessible, to all individuals and families in the community through their full participation. And it's a long definition, and that the community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. Long definition. Let's read it again. Primary healthcare is defined as essential healthcare based on practical, scientifically sound, and socially acceptable methods and technology made at a cost universally accessible to individuals and families in the community through their full participation, and that the community and country can afford to maintain at every stage of their development in the spirit of self-reliance and determination. Now, so some points from this definition that I want you to know. Point one, access. I mentioned this, I believe I mentioned this yesterday, if not Monday. Access. Second point in this definition is very important. Sorry. Families in the community. Next point. Participation or community participation. Next point. Maintain. You want to be able to maintain it. Another term that we can use there is sustainability. I'm typing these words in the chat so that you all can understand that they are important words in the definition. They are important words in understanding what primary healthcare is about. And finally, self-reliance. Self-reliance and determination. Primary healthcare is about access, universal access, easy access to people in a community. The community participates in primary healthcare. It must be done so that it can be sustained. It can't just be a one-hit wonder. And It's happening now, and then everything disappears. And it must be done to promote self-reliance and self-determination. Moving on. So that's the definition. The guiding principle of primary healthcare is that every citizen has a right to healthcare as a means of leading a safe and productive life. Every citizen has a right to healthcare that can lead them to having a safe and productive life. Two words, safe and productive. The word productive has been put in there because healthcare is done to ensure productivity. Only when we are well, we can work. Only when we work, we can earn. Only when we work, we can create. Only when we work, we can discover new territories. And we can only do all of those things if we are well. Health is about being well for productivity. Productivity may not necessarily mean income, but it can be productivity with regards to you maintaining and preserving your health. But essentially, health is about ensuring that we have a productive society. We have a healthy society that's a productive society. Another guiding principle is equitable access to healthcare services based on needs. We spoke about this in lecture 2. Equitable access to health services based on needs. I have a question. Is our healthcare system equitable? Is it equitable? Give me some answers. I'm calling Tia, calling Celine again, Caleb. Not hearing from you all. Is our health system equitable? Our current health system equitable? Mel, Cheyenne, Precious, we don't mind. Yeah, bring the answers on. Yes or no? Is our health system equitable? Reminding you what the definition of equitable is. Equitable. It is equal but not equitable. Very good, very correct, Matthew. Our health system aims at equality. Thank you very much, Precious. It's not. And we would like it to be equitable. We do not want taxpayers to have to pay for the healthcare of a wealthy person who can afford it, who have insurance, and rob. I don't want to use the word rob, but affect the ability of someone who does not have the resources to access that particular service. And I'll give an easy example. Ultrasounds, CT scans, all of those are appointments that must be made months. Sometimes, I remember long ago, a CT scan appointment might be in 2022. If we had people redirected to pay for their health service because they can, that list is going to be smaller and it's going to be reserved for persons who cannot afford. Now, I'm not saying we're encouraging freeloading in any way, that if you keep yourself at a certain socioeconomic bracket, you will always get everything free. I'm not saying that. I'm saying that the reality is We are in circumstances in life, sometimes that's beyond our control. Let's just imagine for a moment, all of you all are working well, things nice, good salary, good jobs. And for some reason, there is a huge, there's a huge protest against pharmacists. And nobody's going to pharmacies, they're going by herbalists, or they're treating themselves because there's this thing that pharmacists bad. Many of you now would be out of jobs. Many of you would not be able to get a new job unless you're a health manager, right? See how important the management classes are. And as a result, you are not able now to afford certain things that you would have prior. You didn't, you may not, so the point of me saying is that this is, you're not always living hard. You're going through a hard time right now. Wouldn't you like to be able to access a CT scan in a timely fashion because it's some growth that there that we need to know what it is? And you would like to know, but you have to wait so long as a result of every Tom, Dick, and Harry on the list, no matter their income status, no matter their ability to pay on their own. This is an example of where our healthcare is driven by equality and not equity, and it ought to be equity. Primary healthcare focuses on equitable access to healthcare based on needs. What's the role of the state? And this must be done in context of the role of the state. Our class is institutional pharmacy management. Immediately, students here would think this is managing pharmacy in the healthcare setting, public healthcare setting, but it's more than that. So what's the role of the state? The state must partner with local and international agencies and its citizens to meet this objective. The state must partner. The state cannot be an authoritarian figure that speaks down instructions, that tells us what to do. The state must partner with local and international agencies. We have some local agencies down here. There are numerous international agencies. And this is done to ensure that the appropriate policies and programs are in place alongside structures for sustained socio-economic development. I want to put this in the chat because it's important. Role of the state. Sustained socio the role of the state is to do things for sustained socioeconomic development. And I am asking, and all of us here can relate to this. I don't know if any one of you are foreign nationals, and I don't know if this is an issue in your country as well. But what is one thing that we can think of that the state should do to aid in our socio-economic development and to aid in access to healthcare? Give me some answers. I want to see some answers. I'm calling out some guys again. I'm calling out Darian, Tia, Sarvish, Precious, Cheyenne, Celine, Mel, Caleb. Give me an example that you think and that you have in mind that the state can do to have sustained socioeconomic development and access to healthcare. Waiting on answers while I continue. So that's the role of the state. What is the structure that is needed? Primary healthcare needs a structure. And we have five here for you. development of health resources, such as manpower. We just did a lecture on human resources. Resources such as development of health resources such as manpower, development of facilities, physical infrastructure, equipment, machines, lab equipment, and supplies, consumables, non-farm stuff, syringe, needle, those things. Organized arrangement of health resources through the establishment of national health authorities. Now, let me see if I get some answers here. Nobody's answering. Nobody can give me an example. We have 10 people looking. Can someone tell me something that a government, no matter who it is, a government should do infrastructure-wise that can lead to better access to health services and that can help it sustain socioeconomic development? I'll still hold on for some answers. So, organized arrangement of health resources through the establishment of a national health authority, the provision of national health insurance, and the integration of public and private health services. Now, where are we in Trinidad and Tobago with respect to this? Now, we have 1, 2, 3, 4, 5. We have 5 regional health authorities, which was an attempt by the government of the day to decentralize health. Their mandate was to privately manage their region, and their mandate was to not adopt the same bureaucratic hurdles as the Ministry of Health has currently. To say it was a success would be misleading, would be far from the truth. Yes, RHAs have a role and function, yes, but are they a success in terms of being efficient managers of healthcare? I think the research would show the answer is no. And that's a good idea for some of you to perhaps look at research in the effectiveness and efficiencies of RHAs in Trinidad and Tobago. Okay, great. Perfect, Vasudeva, you was on point. That's actually what I was thinking. Paved roads, build health centers. So Firaz, building health centers, yes. But let's say we build a health center in some part of the country, but there is no road to take you to that health center. Roads, Vasudeva. There's no need to get political. All right? This is a problem with every single type of government that comes into governance. Paved roads. So you're on point, Vasudeva, with your paved roads. Paved roads equal easy access, quick access to something. In this case, we're speaking about health. Paved roads gives you easy access to a business, and immediately, Leandra, implement measures. I will come to you guys just now. Let me just talk about this point. Paved roads can. I was going to use the example. There's a place called Harry's Water Park. I'm sure some of you may have been there, and some of you would see the water park down in the Shagaramas that recently opened. Nice place as well. But Harry's Water Park has been there for over 10, I am thinking actually probably more close to 15 years. And Harry's Water Park is an excellent water park and is a great shadow of Disney's Blizzard Beach. For those of you who may have been, you could Google up Blizzard Beach. But the roads to Harry's Water Park is the best word, the most flattering word I can use is a roller coaster. The roads to get to there is a roller coaster no matter where you pass, whether it be it's Vancouver, whether it be it Londonville, whether it be through Rio Claro. To get there is a real roller coaster. People get sick, people get tired because it's long and it's bad. If that road was paved properly, access to the facility would be so much more and so much return customers. From my experience in Florida, there are freeways that take you to Disney and there are freeways that take you to Universal because those are real highlight points of the state that millions of visitors go to. Do you think Disney paved those roads? Yes, they may have paved some roads, but it's the state that does that to facilitate persons coming to the state, bringing in funds, bringing in foreign exchange, not foreign exchange, but bringing in revenue. Okay, Leandra, implement certain measures to assess access. You're real tie up my tongue there, Leandra. Implement measures to assess the access of certain healthcare services based on income. Yes, that, dear Leandra, is a good policy to create. You can create a policy with a plan and a project and a framework in which to work in that we are constantly assessing the access to public healthcare based on income. Good. Sarvesh have welfare benefits for those low-income households or single parents. So yes, welfare benefits, that's a social assistance. We have plenty social assistance grants. But remember, we are not supposed to be in these positions for our lifetime. Yes, we might have year after year things might hit us, but we must be continuously trying to get out of welfare. So the welfare benefits is exactly what I'm speaking about in terms of giving equitable access to healthcare. Good. Thank you very much for your feedback, guys. I appreciate it. And I encourage you to visit Harry's Water Park. It's an excellent water park. You would have a day of fun. It's very cost effective as well. And just imagine the road is a roller coaster. So from the moment you divert off the highway, strap on your seatbelt, and enjoy the bumpy ride because it's going to be a roller coaster ride to get to Harry's. So I digress. Great. Thirdly, the structure that is needed. Delivery of healthcare through the media of primary, secondary, and tertiary services. Now we need to get into this. Primary, secondary, and tertiary health services. I would like for you, if anyone here can tell me what is considered primary health service, a primary health service. Give me some answers. Caleb, you're not with us today. Tia, you're not with us today. Celine. Darian, I don't think I heard anything from you all day as well. Give me an example of a primary health service. Not primary health care, primary health service. Any answers? So we have primary, secondary, and tertiary. CDAP. CDAP is an example of a primary health service, Leandra. Good to go. Good to go. Another example of a primary healthcare service is your private doctor. A primary health service, as an extension of what Leandra said, is your pharmacy. What's a secondary health service? Leandra, you're on fire, so tell me. Secondary health service. Come on, boys, you all can jump in as well. Firaz, did I address your Right, I did address Firas. Right. Vasudeva, you're jumping the gun. But no, we're not medical books is not tertiary. Matthew, a hospital and clinics. Okay. I will say no to that because health center. Thank you, Precious. Precious is on point. Health centers. Health centers, or what we know as district health facilities. Health centers or district health facilities. These are places where you have a multitude of services that does not require overnight stay. And getting to someone, Matthew, once we have overnight stay and once we have surgeries being done and once we have specialist services being done, so tertiary is specialist services, surgery, and overnight. Good. Thank you very much, Precious. Thank you very much, Matthew. And thank you very much, Vasudeva. So, Vasudeva, to answer your question, medical books would not be considered tertiary. Medical books are medical books literature. All right, it's not a health service. So, I hope everyone here can understand the take home of examples of primary health service, of secondary health service, of a tertiary health service. Okay, good. Moving on. The fourth structure needed for primary healthcare is economic support through sources such as public financing, foreign aid, and we have the last one. So, public financing or foreign aid. Can anyone tell me? Okay, Vasudeva, can anyone tell me an example of international aid that we get? Can anyone give me or tell me what they think international aid is? Foreign aid? We know what public financing is. There's taxes government pays. What's foreign aid? CARICOM, China sent us mass. Okay, yes, that's actually yes. And so yes to Matthew. CARICOM funding. CARICOM, okay, so the answer to CARICOM funding is a yes if it is CARICOM has given funding to a specific country for health and not just lending the country money. The PM said China sent us mass. Yeah. Okay. I think no, China was offering us. They offered us mask, I believe, and they also offered us testing. So the funding I was trying to get at was PAHO, WHO. Brianna, welcome. Thank you, Brianna. You came in and you hit them for 6. PAHO funding. PAHO donating kits. Great. So yes, international health agencies like PAHO and WHO, those are the people that I'm speaking about in terms of foreign aid. But yes, you are all correct. You are all correct. But the point was specifically about funding and financing. Okay, good. Glad to know that you all are up and paying attention. Great. Number number 5, and the final structure needed is management through strong leadership, policy formation, regulation, and something called M&E, monitoring and evaluation. You need strong leadership. I wish we could do a course, and I would talk to Dr. Maraj on us, because throughout these 3 management courses, pharmacy management, community and institutional management, I try to touch on Vasudeva, I'll get to you on that. I try to touch on leadership because leadership is important. A good manager will have leadership qualities in them. A good manager will have good leadership qualities in them. So in public healthcare, you need good leadership. You need to create good policy to regulate and to monitor and evaluate. All right? Are we good so far? Vasudeva, regarding CPL has no spectators this year. Yes, I heard that. I heard that. Um, I know you probably want to go and watch cricket, but I help me understand the relevance between CPL and the public healthcare. If maybe there is, or actually, I'm thinking yes, because CPL has no spectators this year. We now have a lower burden of being on the lookout for public health issue or public health event happening because we have no foreigners coming in to mingle and Biana. All right, Vasudeva. Yes, Biana hit them for 6. Okay, good, 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 good. And you haven't been all scientific here and trying to make the link in what you're saying to public health. But okay. Yes, Biana, you hit us for 6. You was on point with Paho. All right? Good. Oh, Darian, you're in the dance. Oh, good to see you. I was asking for you all the time. Good. So we are continuing. Yes, Darian, as you're here, Darian, you'll answer some questions when I asked just now, okay? Public health disaster. Don't let the Americans in public. Right. I agree. I agree. The Americans, some of them are very resistant to adopting policies of mask wearing and social distancing. And yes, they are probably more of a risk to us than the Venezuelans, right? So we're not discriminating, but we just need to protect ourselves. Okay, good. Moving on. So to understand primary healthcare and to appreciate it in its full, we need to understand something called the social determinants of health. And these two guys, Feinstein and Kaplan, and their peers, they review the relationships between health and social conditions. Putting that in the chat. Relationship health and right. The relationship between health and social conditions, the social determinants of health. These guys found certain things, and listen carefully. Factors such as housing, overcrowding, sanitation, those three right there. Those three right there, guys. Getting back to some discussion, those three: housing, overcrowding, and sanitation. Immediately, what group comes to mind in our country right now? It's a issue in our country for a few years. They are our neighbors. What group comes to mind? Waiting on a few answers. Biana, hit me for 4 this time. Darian, what group? Yes, yes, Matthew. Thank you. You beat them to it. Our immigrants are living in sometimes a 1-bedroom place with 12 of them. 4 might sleep on one bed, 4 might sleep on the ground, 4 might sleep in the living room or kitchen. That's a real disaster. And those are real factors that determine a person's health status. Transit mode. How do you travel? Do you walk? Are you in a taxi service that is known to be crazy and wacky, that getting accidents? Are you in public transport that's known to break down and catch a fire and or run off the road? What are your occupational hazards? Where do you work? Is your workplace safe? Is the nature of your work safe? Those things are real important questions that people have. Environmental hazards. Do you live in an environment, for example, any of you here from Cuba? Tell me if any of you here from Claxton Bay. Claxton Bay, anyone? Give me some answers if anyone of you from Claxton Bay. Where you live, what are the environmental hazards where you live? Temperature, flooding, dust, education. What's the education level of the person? How does that affect their appreciation of healthcare and their health status? Income, employment, lifestyle practices such as smoking, diet, exercise. All of these were identified as critical factors that influence health status, and I'll go them over again. Housing, overcrowding, sanitation, transit mode, occupational hazards, environmental hazard. Anybody from Claxton Bay? Mosquitoes, environmental hazard. Nobody from Claxton Bay? Well, the point I was going to make about Claxton Bay is there is a company called TCL at Claxton Bay, which is Trinidad Cement Limited. And I know for many years, I don't know if they've solved that problem, but for many years, you would drive along the Southern Main Road in Claxton Bay and you would see the trees, the leaves are all covered in cement dust. They're all covered in cement dust. So you can well imagine the quality of the air that persons who live there and persons who work in that area, what's their status. So that was my point about Claxton Bay, air quality. Yes, Darian, thank you. You're in the game. Air quality, good. All right, so we have 3 more slides to do. Let me just finish up this one and we'll take a break. We'll come back and do the last 3 slides because I don't want to rush through this. This is an important. Several questions come from this lecture, so I don't want to rush through this. So, and the social determinants of health, also the impact of globalization and the socio-political context, culture, the labor market, education, family, social system values, and support systems all have effects on the social determinants of health and specific exposure factors. All right, culture, the labor market, education, social system values, support systems. We're using our immigrant population as well as an example. They come here for work. They bring their culture. Their culture may not meet our sanitation standards here. Their values, the way that they behave and the way that they live might not be the way we behave and live here, and it can affect a family that lives next to them. It can affect their stress level. All of these things are social determinants of health, and I want you to have a good appreciation for it. Okay, so any questions before we go for a break? Questions, anyone? We're going to go for a break and then we're going to return at 2:25. Any questions? Any queries? Are we all understanding what we're discussing today? No questions, Matthew. All right. Okay, good. So we'll go for a break. We'll resume at 2:25. I'll send you all a link on WhatsApp. Okay.